I'm Elena Stoffel. I'm a gastroenterologist and director of the Cancer Genetics Clinic at the University of Michigan Comprehensive Cancer Center. Our manuscript, published in Gastroenterology, looked at findings of inherited predisposition syndromes in young people diagnosed with colorectal cancer. As has been shown by multiple studies, the incidence of colon cancer in young individuals is increasing. And since colon cancer is a potentially preventable cancer, it's important to know why colon cancer is increasing, and it's important to be able to identify which young individuals are at increased risk for developing colorectal cancer so that we can offer early interventions such as colonoscopy, which can actually prevent cancers from developing. In our study, we examined the results of genetic testing in 430 young people with colorectal cancer diagnosed under age 50. And in our cohort, we identified that approximately 1 in every 5 young colon cancer patients has an inherited genetic factor that predisposed to the development of colorectal cancer. This research is very important because it showed that we found genetic alterations in patients who normally would not have met criteria for genetic evaluation. Usually when someone's diagnosed with cancer, if there's no family history of cancer, we think the likelihood of an inherited factor is unlikely. However, our study suggests that even in the absence of a family history of colon cancer, it's important for young people with colon cancer to undergo a genetic evaluation. Identifying an inherited genetic factor in a patient with colon cancer can actually benefit their treatment as well as the treatment of other family members. Because if we identify an inherited genetic factor in one person, it's possible to test their family members who don't have cancer diagnoses and implement early colonoscopy in those patients. So our study shows that identification of people at risk for cancer is incredibly important, and referral of young people with colon cancer for genetic evaluation can potentially impact their own treatment as well as prevent cancers in their families.